We all know that our state, along with all other states, I believe, have extensive budget shortfalls, and there's not enough funds to go around. And one of the many areas being targeted for cuts are the services to adults with disabilities that are in need of developmental and psychosocial services. There are many other needs that are also great in our state. Members of the legislative and executive branches of our state, along with individuals from Health and Welfare Administration, have advocated that volunteers could take up the slack of these services that would be cut. There have been even some individuals who have called the services that have been going on glorified babysitting. Those of us who have received the benefit of those services know better than that. An Idaho economist has estimated that nearly 2.25 million volunteer hours per year would be necessary just to cover the services that are provided by these developmental services and the psychosocial services. And if you spread that out then if you got, say, volunteers that would do 100 hours per year, we would need over 22,000 additional volunteers. I think what some of those people at the state level don't understand is that many of us already receive much volunteer help for those individuals. And I wish to thank all those who help us as parents with that task. Mrs. McCurdy indicated that individuals need to walk in the footsteps of those families who have these adult individuals with challenges. And I just was thinking, why don't we do just a little pilot study? We could do it right here in Madison County. It would be a short and limited pilot. We could let our local legislators be the model citizen to show us how to volunteer. To the best of my knowledge, there are at least 35 to 40 in just this little small local area, not even the entire county, that are receiving services. And if each of those families could just send their child one day to the home of one of our legislators, that would just mean that they would have to take 12 or 13 days of their month to care for these individuals. Now, on second thought, I was thinking, but if they do that, we're going to have them get criminal background checks. They're going to have to be I'm just explaining the things that are necessary for us to have these people in our homes. They'll need CPR and first aid training. They'll need their homes inspected so that they're safe with fire alarms, smoke alarms, adequate water and sewer, functioning properly, that the electrical is all safety, and they'll have to pay for that inspection themselves. They'll have to be trained on how to administer medications. When I drop our Sarah off, I can train them how to floss under her retainer and under her bridges and do all of that work. And all of the other things, each parent will have certain things they'll need to train these volunteers with, when to take the medication, how to take the medication. Each one has special needs. If this short pilot works out, we went for a couple of months doing this, and the legislature could see that this was going to work out well, then we could maybe expand it, and certainly expand it to the other areas of the state and get Governor Otter in on this project. He could bring these individuals into his home for a 24-hour period each day and take his turn several times a month and show us how this volunteer works. I don't think they are aware that many, many people are already volunteering to help with these individuals. And I guess what it comes down to is we either raise more money or we cut services. My plea with the legislature, is that we choose areas where it will have less impact on less vulnerable population, and that we aren't afraid to step forward and pay for the services that are needed by these individuals. Thank you.